So when we're thinking about prevention, and just kind of in generally before we look specifically at environmental prevention, I wanted to kind of talk about the definition of prevention and what it looks like and how that might serve us in the environmental prevention side. So the definition of prevention, really the field that we're in, is that prevention services are a planned sequence of culturally appropriate, science-driven strategies intended to facilitate attitude and behavior change for individuals and or communities. So when we look to break that down, for the first piece, we're really looking at a planned process. So we did a webinar on the Strategic Prevention Framework a couple of months ago, and if you're not familiar with the SPIF process, I definitely recommend that you check out that webinar and you can search into that further. But we're really looking at processes that are planned and very thoughtful. We're all working off of very limited resources, and we want to make sure that those resources are maximized. We also want to make sure that we're culturally appropriate. And through the Substance Abuse Prevention Specialist training, the SAPS training, one of the things that is a current theme, or a consistent theme throughout the training, is that there should be nothing about us without us. So when you're looking at impacting various parts of your community, you want to make sure that those target populations are included in the discussions that you have so that you ensure that they are culturally appropriate and that you're able to best meet their needs. We're also looking to be science-driven and evidence-based. For the program that we get from the federal level, when we look to the funding that we get from the state level, everything that we have is focused on evidence-based. So we want to make sure that we are using the most cutting-edge evidence and resources in order to make that happen. One of the most challenging parts of our work is that we need to not only change individuals' attitudes, but also behaviors. And even more broadly than that, we are needing to look at the attitudes and behaviors of entire communities. So that can be a real challenge when you're looking to make that community-wide change, particularly when you're looking at the cultural appropriateness of various communities. And then finally, we're really looking at that population-level change. So we're looking to change entire communities, not just individuals, in the effectiveness of the work that we do. And it's challenging enough to get into classrooms and provide prevention services, but from a community-wide level, that can be a challenge as well. One of the benefits to that is that it's very challenging, again, to get into those classrooms, and if we're looking at a much larger global level, then we're going to be more successful in getting into some of those doors. So when we're thinking about the type of activities that you do, just wanted to think very globally of the type of activities that you do. So utilizing the chat section or the question section, just type in some of the things that you do or that is done in your community related to prevention services. So just take a couple minutes to type in some of the things that you're doing within your community just related to prevention. And as some of these things come in, I see that Parents Who Host is something that's being implemented, sticker shock, life skills training, doing town hall meetings, classroom prevention, community-based efforts. We've got a media program that is focused on Spanish radio, so again, kind of looking back at that cultural appropriateness. Coalition alternative activities specific for youth. I see Red Ribbon Week is mentioned. Resources and kits for communities, a social norming campaign, education programs for high schools, media campaigns, coalitions. I see some more alternative activities and life skills. And thank you for that feedback. And as you continue to write that in, that will be helpful in our follow-up is to get a better sense of the things that you're doing. So when we're thinking about the type of activities that you do, the Center for Substance Abuse Prevention, CSAP, which is a segment of SAMHSA, has divided prevention activities within 6 categories. The first being alternative activities, which were mentioned here, along with information dissemination. Alternative activities would be healthy alternatives, they are an alternative to using substance abuse. Information dissemination would be like pamphlets at health fairs. It could be some media messaging. Education, so skills, life skills and other things within schools, or parent education. Employee assistance programs can be both problem identification and referral, and education. And then we get when we're towards the latter ends of that, we're looking at community-based process, which would be coalition-focused and environmental. So when we're looking at the 6 CSAP strategies, there's really a pretty strong definition or division between the first 4, which are primarily focused on individuals and individuals' attitudes and behaviors, and the latter 2, which are primarily focused on communities' attitudes and behaviors. And this is really where, from the latter part with the community-based process, your linkages and groups come in with your coalitions, and then this is where we look at environmental strategies as well. So when we're thinking about these 6 CSAP strategies, there are opportunities to look at these individual-focused areas in addition to some environmentally focused areas and have some unity and collaboration based on that. So when we're looking at a successful prevention approach from both an individual and community level, there are factors that kind of lay into that. So when we're looking from an individual perspective, we're really looking to change their knowledge through school-based programs, through other things that they might receive within the community, looking to change those attitudes, beliefs, and behaviors. And again, it's easier to change attitudes than it is to change maybe beliefs, and even more difficult to change behaviors. Because I know that McDonald's is not the most healthful of places to go, and so that is an attitude and a belief that I have. But when it comes to behaviors, that doesn't mean that I don't go there. So when we're looking at changing attitudes, beliefs, and behaviors within individuals, there's a kind of a process that goes along with that. We can use some environmental focus in factors to help support that. So when we're looking from an environmental perspective, the 4 areas that we're really focused in on are community norms. What do we see as acceptable and unacceptable? What media messages are occurring within the community that kind of set the tone for the community. And when we're looking at defining community, it is really as broad or as narrowly defined as you want it to be, or what best fits your community. So when we're looking at a community, that could be a county, that could be a neighborhood, that could be a school district, it could be a street in a neighborhood. So what community is defined at may look different as to the strategies that you're interested in implementing. For instance, for the Columbus area, the coalition that they're working on, particularly focused on marijuana, they define their communities by a zip code. So it can vary greatly. So when you're looking to make these changes, be thoughtful about what your community looks like and who's made up within that community. Along with those community norms and media messages, we're looking at access and availability. So how accessible is alcohol, for instance? How available is it? And how do the policies and enforcement of those policies allow for increased access and availability or decreased access and availability? For instance, if you have a policy in which parents aren't able to provide alcohol to their children's friends, that's a policy that's instilled, but if that policy is not enforced, then parents are going to be more likely to provide that alcohol, and then that's going to impact the access and availability component of that. So just kind of a little sense of warning, if we only focus on the individual, he's expected to make healthy choices in an environment that supports and encourages the opposite. So for me, it is kind of as a way to think about what that looks like. When we're looking at an environment, the environment really should support the needs of the individual. So I have my little snowman here, and he's melting away. Right now, we are in Ohio, and in Ohio, it's about 40 degrees outside. So the little snowman's melting away. Our environment right now is not sufficient towards his survival. And we see that a lot in communities, that we try to prepare our individuals and put them in environments that are just not conducive to their survival. So when we're thinking about these individual strategies, we also want to think about the environmental strategies that can help support that. And when we're looking at successful environmental strategies, we're really looking at system-wide level change. So we are not focused on the individual level, but really broader than that. And when we're looking at that system level, from an environmental strategy focus, it doesn't have to be the entire country or the entire state. We can have environmental changes within a school district, for instance. So the system doesn't have to be huge. It can be a size that is appropriate. And with the availability of making some of these changes, then the impact that those changes have on the micro-community could lead to stronger and larger changes on the surrounding communities. We also want to focus on reducing community problems or increasing health and safety. So we want to make sure that, in general, we're creating a healthier environment for our folks to live in. And we want to look at enhancing those individual strategies. And we want to really support that individual level change, going back to those attitudes, those beliefs, and those behaviors, so that we can have the greatest change on the individual, so that they can also change what the community looks like as well. And we also want to focus on collaboration, because none of us can be successful operating alone. We work best when we're working with others to help with those collaborative effects. So when we're looking back to the previous slide and looking at community-based process and environmental strategies, the two are really important in building pieces from one another for a community-wide change, because it does require collaboration, and you can't do it all by yourself. So thinking about a great example of system-wide environmental change is related to tobacco use. I think that is a prime example of something that we can really hold up as a success that we've had within our country. So within that, we've got some changes that have happened. And when we think about tobacco use and just the overall perceptions, and kind of researching the timeline, it wasn't until 1954 that the link was really made between smoking and lung cancer in a very public way. So when we're looking at the last 60, 70 years, there's a pretty significant change that's happened since then. And you can kind of look through that, the change there, pointing out 1998 when California passes the first statewide comprehensive smoke-free air law. Now, many had been passed previous to that, but this is really the first time that a state had really taken on the focus of really looking to tackle at a large level. Then we have the Master Settlement from 1998, which really changed the landscape that we have in relation to providing resources and funding for states to really tackle tobacco prevention and cessation efforts. And then we've gone from there with the FDA now having regulatory authority over tobacco products, or over cigarette products, and looking more now towards more universal tobacco products. And even looking at the Affordable Care Act and the expansion that provides for benefits to tobacco cessation efforts, we can see that there's been a strong gradual shift throughout the years related to tobacco use. And a great way to kind of get a sense of what that looks like from a numbers perspective is just looking at the rates of high school student use and adults from 1965 until 2011. 2011 was the most recent data that I could find by the CDC. So when we look at that, we see a significant and gradual decrease in tobacco use among both adults and students kind of throughout that time. So we've got the numbers to support it, and it's also nice to have some visuals that help to support it as well. And for me, in my mind, when I was young, go into the McDonald's, and there would be the smoking section and the non-smoking section. And there would be the little sign that would say that it was the smoking section. And just the change that we've had in our environments and our community norms related to the acceptance of tobacco use, particularly when we're looking at the way that they've changed within our retail environments and other areas that we talk to frequently. So when we're looking at some of these changes, we've had great success from the tobacco side. We've also had some significant challenges on other sides. So our work is really ongoing, and we need to focus on not only just living off of our successes, but continually making changes and modifications as we move along. So while we've had great success on the tobacco side, marijuana tends to be an area in which we are struggling on a national level. So we want to make sure that we are able to kind of learn from some of the things that we can learn from tobacco and see if we can adapt and implement some of those for some of the things that we're seeing with marijuana. So we've got visuals kind of supporting marijuana use and promoting it. We've got well-known actors that are talking about the benefits of marijuana and not to believe the research behind it. And we also have kind of the timeline that goes along with it as to how quickly marijuana has expanded so from the 70s when decriminalization began with Oregon to just 5 years after that to expanding to multiple states. Now marijuana is decriminalized in many states, and in fact we have nearly half of the United States that has some form of legalized use of marijuana. So when we're looking at environmental prevention strategies, we want to be very mindful of them and how they can be impacting us not only now but in the future as well. And another great example of kind of a visual for this is back to the numbers. When we're looking at the number of those who smoke marijuana, we know, as we mentioned previously, about access and availability and how strong access and availability leads into what use looks like. So this graph, I understand, is kind of difficult to read, but the big piece to take away with this graph is that those states that are in red are states that have legalized marijuana for medicinal purposes, and they are also the states that tend to have the highest use rate. So just kind of going back to that focus on access and availability and those policy and enforcement measures that we'll go into in much greater detail in our second and third webinar. Just kind of wanted to lay this out to get a big sense to see what that might look like. So when we're thinking about environmental strategies and those benefits, one of the benefits is that they reach entire populations. They're also more cost-effective than individual strategies, more cost-effective than treatment interventions, and definitely more cost-effective than not doing anything at all. So when we're looking at cost-effectiveness, just from an individual prevention perspective, it can be very challenging to have sufficient funds to get in front of every single person within your community. But when we're looking from an environmental perspective, when we have multiple partners kind of working in that direction, then that will be helpful in making those connections and having that community-wide change. We also want to create short and long-term change. And I think the tobacco example is a perfect example of what that short and long-term change looked like. That we had policies that were instituted in schools, that expanded to workplaces, that expanded to retail outlets, to expanding to entire communities, and now in many cases we have statewide laws and policies that prohibit tobacco use, particularly smoking. So we can see how those short and long-term changes will have lasting effects that will go far beyond just those individual approaches. It's also measurable. Again, I think a great example of tobacco use rates is prime opportunity to see the measurable behind that. It's also evidence-based, and as we look to have strategies that are evidence-based within our communities, when we're looking at funding to support those are all things that we kind of want to focus on, and they enhance individual strategies. So when we're thinking about some of those individual strategies that it enhances, we've got some encouragement of not to use at all. So really supporting that no-use message from an individual perspective. We have that excuse to abstain. So from an individual perspective, that there's this research behind it, shouldn't be any reason as to folks not knowing the health risks, the financial impact of using tobacco. Also supporting cultures that promote quitting with the Tobacco Quit line that's available in the States, and the cessation services that can kind of go along with that. And we have collaboration from multiple partners. We've got the American Cancer Society, we've got state departments, we've got the American Lung Association, we've got a wide group of folks that are working to prevent additional use of tobacco in individuals and with communities. So when we're looking from an environmental prevention perspective, again, looking at those 4 areas, looking at community norms, media messages, access and availability, and policy and enforcement, I'm really interested to see what areas that you're working on in your communities. So this will be our first poll question, and for the poll question, it should be coming onto your screen shortly. And that question is, which of the following environmental strategies does your community currently implement? So whether or not you are working specifically with environmental prevention strategies, what are some of the environmental strategies within your community that are occurring? So just take a moment and complete that information. You can just check the box, and you can select all that apply. And it looks like media messages is currently the primary strategy. Again, the question is, which of the following environmental strategies does your community currently implement? I'll give it just a few more seconds to get those in. Looks like media messages are still coming on top. Thank you. And on your screen, it should come up the answers. It looks like the primary area was media messages, followed by access and availability and community norms, and then policy and enforcement. So the 3 areas all tied, the 3 back areas all tied one another, with media messages being most prevalent. So this is going to be really helpful when we're looking to examine the second and third webinar as to where to focus. It looks like in general, communities are primarily just focused on all of the prevention strategies, with possibly media messaging coming out first. So thank you for taking that opportunity to respond to that. When we're thinking about some public health examples of environmental strategies that we have, they are varied, and these were just some focused on underage drinking or drinking in general. So we have things related to drinking and driving, like the Drive Sober or Get Pulled Over campaign, looking to increase seatbelt utilization with the Click It or Ticket day and night, and just thinking of the community changes that have happened from there, and just seatbelt utilization. Also, an Ohio initiative that's not a single drop, really focused to educate parents about the importance of mothers not drinking while pregnant, and then with the Parents Who Host Lose the Most, Don't Be a Party to Teenage Drinking message that is implemented throughout the country. So these are all kind of public health examples of what environmental strategies can look like in order to address different topics. And while the primary focus of these campaigns are media messages, there are all pieces that kind of support other areas. So for instance, the Drive Sober or Get Pulled Over, it's a media message. It also speaks from a policy and enforcement perspective, and really will hopefully look to impact some of the community norms related to drinking and driving. So one of the focuses that we want to have with these webinars is looking at that sustainability piece. And when we're looking at sustainability, in many cases, sustainability means money. So when we're kind of thinking of where we are in the prevention field compared to other areas, when we're looking at the cost of advertising of tobacco products annually, it's $8.4 billion. When we're looking at the annual impact of tobacco use on the nation, we're looking at a financial cost of $289 billion. And when we're looking at the number of lives that are lost each year related to tobacco use, then we're looking at 480,000 lives, 41,000 of that being related to environmental tobacco smoke or secondhand smoke. So when we're working with our community leaders, looking to have sustainability and support for our environmental change efforts, it's important to really look at the costs, not only the financial costs, but the cost of lives related to those things. And when we're looking at from a pro-marketing side, so the tobacco industry spends $8.4 billion to get people to smoke and to be loyal to their brands. When we're looking at their strategy, the more they advertise, there's going to be a return on their investment, which will lead to additional resources and revenue for them. That doesn't quite work the same for us from the prevention side, because just because we've got additional, or the funds that we have and the work that we do in terms of media messaging or working to address access and availability or changing those community norms, the more work that we do oftentimes relates in additional demand, but not necessarily does that demand relate to additional dollars. So this is really where it's important to be able to show the work that you're doing, your ways to really encapsulate what you're doing and engage those community leaders that would be able to assist you with that. And a key to your sustainability efforts is measuring success. So how can you measure your success, whether your success throughout your process of the strategy that you're implementing or your overall outcome of the strategy? So wanted to take a little bit of time looking at process and evaluation and outcome evaluation to really get a better sense of what that looks like, because these are keys to your sustainability from your environmental approaches. Because if you don't have sufficient data indicating that you're being successful, then communities are not going to be as willing to buy in for that. So when we're looking at process evaluation, we really want to look at monitoring that implementation. So we want to see what is and what isn't working. We also want to look at improving that implementation and being able to make changes as appropriate. So if I'm adopting a program, say for the Parents Who Host program, for instance, and I'm having challenges with the implementation, how can I go about to make some of those changes in order to do something that's perfect for my community? So for instance, if I'm implementing the Parents Who Host program, and during the implementation piece, if I learn that the source of alcohol for youth isn't parental access, it's retail access, then the intervention model that I have isn't appropriate for my community. So Parents Who Host would not be the appropriate model for you. So you'd want to instead institute or implement something that would be more appropriate, such as increased compliance checks or responsible service training for retailers to make sure that that implementation is appropriate. And it helps you with making future decisions, because you want to use your data to determine the interventions and the outcomes that will be most important for you, because that's all going to lead to your sustainability. So when we're thinking about process evaluation, we really want to examine how program activities are delivered. And we want to ask questions of what did we do, how much did we do, and how well did we do it. Those are kind of the three questions to ask for a process evaluation. Again, those questions are what did we do, how much did we do, and how well did we do it. So if we're looking for a county-wide level, we're focused heavily on the activities that we're doing, but we're too broadly spread, then that may not have the impact of just focusing on one individual area. So monitoring those program operations, look for checking the implementation, having checks to kind of move about, document and provide data on activities. So when you're doing something, how are you going to be able to document what you're doing? Whether that's related to a newspaper advertisement or getting a ordinance passed within your community, how can you document those efforts? Because when you're looking from support and the sustainability piece from those who would be providing you with funding, they want to be interested on their return on investment. Because if they give you money, they want to see that there's a benefit to that money and that they're not providing resources to you that can be better used in other areas. And it also indicates if changes are needed. So again, with the Parents Who Host example, if you're implementing a strategy that's not appropriate for your community, then you want to be mindful and know about it early on so you can make those course corrections before you get to the end and say, oh shoot, well, we totally missed the mark there, but hopefully we'll catch it next time. So we want to be very thoughtful about that. So when we're thinking about our process of evaluation, we want to look at how programs activities are delivered, those monitoring pieces that go on there, again, and if changes are needed so we can make those changes. So there's challenges for both process evaluation and outcome evaluation, and just kind of in general. And then when you're looking to specific to environmental change strategies, there are some additional challenges that can kind of come into play that are even more challenged than the individual prevention strategies. So one of the challenges is measuring participation. So for an individual strategy, we have our sign-in sheets, or we have our pre- and post-tests, and we know from there how many people participated. We could have a sense of, if we do surveying, what their age is, and get some other demographic data. When we're looking for environmental change strategies, that can be much more challenging. So instead of focusing on the individual populations, really think about how you could have some collaborative check-ins. So for the collaborative check-ins, talk to your community and coalition partners, see what they're doing, see what data that they've received, and see how that might be able to provide insight and feedback. When we're looking at evaluation, not all evaluation has to be quantitative, which is numbers. It can be qualitative evaluation as well, as how do we see this intervention working within our community. Another great opportunity is to check in with key leaders and do some interviewing there. The key leader should have a pulse on the community and have a sense of what's changing and how your interventions are being instituted. One of the benefits of doing the key leader interviews is that you can also get key leader buy-in as you explain your intervention strategies to them and see if the intervention strategies have had effect on the community. So they can see the efforts that you're working on and how they might be able to partner with that. And then also through community member surveys. And you don't have to measure every single member of the community, but if you have a kind of a general guide to get a sense of what the general community members are thinking or seeing, then that will be very helpful in making sure that you're on track. So these are all kinds of things to think about when you're thinking about your process evaluation questions. Another question is the ability to measure fidelity. And fidelity in environmental strategies is much more challenging than in individual-based programs. So when we talk of fidelity, fidelity is the degree to which a program is implemented in how the developer has intended. So the focus there is to make sure that there are a set of core measures or pieces that each person will be connected with. So when we're looking from an environmental perspective, it's really hard to know what that fidelity will look like, particularly since all communities are different and they have so many different facets to them that it's very hard to see or make the connection from what worked in one community to what worked in another community. So instead of trying to drive yourself crazy with getting those fidelity measures and being able to implement them, it's important to really know your community and know what would work well and what wouldn't work well. Also talk to like communities who have had success and model what has worked well for those like communities and be prepared for changes. A great example of a fidelity measure or really knowing your community, going back to the Parents Who Host program, which I am somewhat biased to because I oversee it, but it's a great example of some of those measurements, because in talking to communities, there was a community that tried to institute the Parent Pledge, and the Parent Pledge is a pledge that is distributed to parents within a community with the focus of getting them to sign on to say, I pledge not to host underage drinking parties. Well, they did not have a sufficient community support for the Parents Who Host message or really have an understanding of what the message was about, so parents were reluctant to sign this pledge, so their effort wasn't successful. So when we're thinking about being appropriate and really knowing our community, sometimes it takes a while to get that community buy-in and support, so don't have strategies or interventions that aren't going to be appropriate for the needs of your community. Be sure that you have a sense of where they are, you're able to meet them where they are, and are able to then take them to hopefully in the direction where you'd like for them to go. And a way to be thoughtful about this approach and get a really clear sense of what your community looks like is logic modeling. And logic modeling can be very stress-inducing. I do trainings for the Strategic Prevention Framework and the Substance Abuse Prevention Skills training. And when we get to the logic model sections, I see people just get so frustrated and overwhelmed by the whole term logic model. So logic models should not be stress-inducing. They should help you and be an approach that should give you validation and benefit. So if it's something that you're stressed out by, then you're not doing them correctly. So what logic models are and what they do is show connections between strategies and their desired outcomes. That is all. And what they are is stepping stones. They're not to provide details and fill in all the gaps, because if you're trying to fill in all the gaps, then that's not really a logic model. That's a strategic plan, and it's much more detailed than that. So a logic model are basically just stepping stones of where your community is to where you want your community to be, and these are the big steps to kind of get you there. So they should be simple. And if you have a logic model that you can't go up to a member of your community who is not strongly invested in the work that you're doing, if they're not able to understand what the logic model means, then it's not a good logic model, because it should be simple and it should be something that everyone is able to understand very easily. So when we're thinking about this underage tobacco use, which will kind of be a theme for today, this is just a very basic logic model to kind of get you from one side to the other. So when we're thinking about a basic logic model, behaviors and related problems, so the problem that they see within the community is underage tobacco use. Their goal, which is on the far inside, to address that is to reduce underage current use. So there's some steps to go along that way. In identifying the needs of the community, they've identified resale access as being the primary source of tobacco access to teens, so that is their risk and protective factor area. For interventions that they want to focus on are compliance checks and merchant education. So you have two intervention strategies. And when we're working with multiple intervention strategies, it can kind of sometimes be difficult to determine which is most effective. And we'll talk about that a little bit later. But in short, as long as you're working off of evidence-based practices, being compliance checks, being merchant education, things like that, then those will be interventions that should be beneficial to you. And if you have challenges with implementation, that's really what your process evaluation is really supposed to get to. Also, when we're looking at our short-term outcomes. So before we get to our long-term outcome to reduce underage use, we really want to look from a short-term outcome of reducing the number of sales to minors. So this is a very basic logic model. We could fill in additional details as needed, but it's not really separate or important to do that, to fill in all the gaps between, because the basic tenets are set up. And with this, it's a logical plan that hopefully anybody can see to get a sense of what their community looks like. So this is a very basic sense of logic modeling. And logic models look different, and I know that different funding organizations have different ways logic models are laid out. And so, again, please don't be stressed by logic models. They're really meant to help you and your communities to understand where you are, your focus areas, and how you're going to get to where you are to where you want to be. So when you're thinking about your outcomes for your community, be mindful and knowledgeable of your timeline. If you're working on a one-year grant cycle and you're expected to have community change in use of tobacco consumption, is that something that's realistic? So make sure that with your timeline that you're very thoughtful about what you can achieve and what might be a stretch. We always focus on things that are doable with a stretch, but we don't want you to be stretched into bits. So really want to be thoughtful about that and really understand that change doesn't occur overnight. It's a gradual process, particularly when we're looking from an environmental perspective. So when you're looking to funders or your partners, it's important that they realize that this isn't a 1 month or a 6 month or sometimes even a 1 or 2 year process. It can be much longer than that. Going back to the tobacco side, we saw the health effects of tobacco being really realized from a national perspective in the 50s, and it took quite a while for those changes to be instituted at state and community levels. Also, whenever possible, look at your baseline data. See what your data says and how you can kind of pull in from your data to really make some of those changes and use your baseline data as the platform in order to make your community neat. So your baseline data is basically just asking, what does your community look like now? Comparison data is a good source, although no community is alike, so I kind of caution using comparison data, but it could kind of give you a snapshot of, are you on par or on trend with other communities? So when you're looking at comparison data, you can either look at other communities that are like you can look at state data, or you can look at national data to get a sense of trends in how things look in comparison to what your community looks like. For instance, going back to that slide with the marijuana legalized for medicinal purposes, we see that comparatively, those that have medicinal marijuana within their communities also have much higher rates of marijuana use. So it's important to really get a sense of what those data pieces look like. Also important to use multiple data points because if you only look at one data point, then it might be deceptive. So if, for instance, you're looking to impact underage drinking parties, but law enforcement has not at all been involved in underage drinking parties and has not been involved in enforcing that law, if you ramp up those efforts, then the number of underage drinking parties that are now seen within your community is going to increase, which will be good for the long term because there's more knowledge about it, it's being appropriately enforced, but that can skew your data if you're only looking at one data point. So make sure that you're using as many data points as possible and use as many collaborative partners to kind of help with that. So when we're looking at some challenges related to outcome evaluation, one big challenge is really assessing the impact of the individual components. So as the logic model that we had related to tobacco use laid out, the two individual interventions that we were looking for were compliance checks and merchant education. So for those two pieces, don't focus too much on one or the other, but just kind of look at the overall success. In general, was the merchant education and compliance checks, were those two interventions successful for reducing access to tobacco by young adults or by young people, and then did it lead to the reduction in rates? So don't get too caught up in which individual strategies are working unless you're at a point where you really need to from a financing perspective in order to get support for it. Then you might want to kind of lay out some of the pros and cons related to that. Again, use quantitative and qualitative data to measure your impact. So we can get a lot of great information from qualitative data. Numbers are important, but the stories that support the numbers are often important as well, and a lot of times those are overlooked. So make sure that we're really focusing on both the quantitative and qualitative aspects for the data and utilize them in tandem. For instance, if we're looking at social norming and compliance checks, those things can have both quantitative and qualitative elements that can kind of support the use of those things. Another challenge that we see related to outcome evaluation is collecting data from all members of your target audience. So again, when you're looking at instituting those things, nothing about us without us, we really want to look at some of the resources that we have to kind of get to that. So what are some of the resources that are available within your community? You don't really need to reinvent the wheel. Some of those surveys are already being done. It's just important to tap into those. So is there an annual student survey going on within the schools, within various age ranges within your student body? Are there attitude or behavior surveys being conducted for adults? Can we look at arrest data or coroner's reports to see what data that might look in? School data, what do retention rates look like for students, and can we make a connection with retention and substance use, truancy? All those are correlated effects, and also looking at treatment data to kind of support that. And if there's a survey that's going on that doesn't really fit with some of the things that you're interested in, then see if for a little bit of additional dollars that you can kind of throw their way, if they wouldn't mind adding some questions to that. So, for instance, in Ohio, we now have casinos that have come here, and with the casinos, there's a stronger interest in getting data related to gambling in the state. So there are current student surveys that are conducted, but those student surveys many times don't have questions specific to gambling. So we're able to use the surveys that are currently being implemented, add some of those questions specific to gambling, so we can have some additional data. We also don't want to have data fatigue and over-survey our population groups, so as many times as we can collaborate, the better off we'll be. Another challenge is related to research design and choosing one that's very appropriate. So we want to make sure that we are working with an evaluator when things like that are kind of coming together, because it can be very challenging, particularly since changes are often fluid within community. Our environmental changes are fluid, so our efforts to provide responsible beverage service training, for instance, might be strong, and we could have good buy-in with that, but it's also a population that changes over frequently in terms of the retailer or the beverage service providers. So we want to be knowledgeable of that and also understand that our environmental impact and changes might need to shift and change based on the changes of the community. So we'll want to focus on that as well. And so solutions for that is really looking to examine trends over time. And these are some interrupted time series design. I am not an evaluator, so I can only speak from a very basic level related to these solutions. But if you are working with an evaluator, certainly talk about this with them. If you're not working with an evaluator, it's a great opportunity to set up a network or a collaboration between a local college or university to kind of help with that. Also, community colleges are a great avenue to kind of help get some support for local communities. Also, think about using some quasi-experimental design and time series designs to help with that. So when we're thinking about some of these challenges, other considerations that we should consider are multiple factors that influence outcomes. So there are other things that are impacting our community other than just the interventions that we're implementing. So we want to be knowledgeable of those multiple factors and see what we can do to kind of impact that. Because we cannot definitively attribute positive changes to our interventions. So environmental outcome measures require varied collection strategies. It's not like when we're doing education-based programming that we have our set audience that we can ask questions and we can do tests as we move along, and we know that we'll have the same population going through. Environmental strategies are very different from that, so you want to make sure that your measuring is in varying degrees as much as possible. Again, those implementation and fidelity standards are less concrete for an environmental perspective. And is it causation or correlation? From a individual-based prevention program, it's usually a lot easier to make that relation to causation. For environmental strategies, correlation is sometimes the best that we can get. But really the biggest focus is, or should be on, are we making a change in our community? And if we're making a change in our community, then hopefully the cause is our interventions. But if the closest we can draw is a correlation, then we should be happy with that. So when we're thinking about specific to those outcome evaluation measures and looking at short-term and long-term measures, examples of short-term measures would be calls to the tobacco quit line, rates of non-compliance for tobacco retailers, surveying residents to monitor their attitude or behavior related to tobacco use. While tobacco use rates continue to decrease, and we every once in a while see a little uptick, we have other things that come in, like vaping and smokeless tobacco, and other things that we want to be mindful of. So we need to continually make adjustments to our processes as we move along to make sure that we're really meeting the needs of our community. When we're looking from a long-term change perspective, looking at those, the knowledge of tobacco's impact, looking at those trend data that we see related to that, and looking at those behaviors, we've seen those smoking rates that have decreased in the United States. So these are all examples of successful measures that we've seen. So when we're kind of looking at our keys to sustainability, our focus, there's kind of three pieces of our focus. We want to have community buy-in, which is really cultivating community buy-in for not only prevention services, but for overall health promotion. We also want to look at organizational capacity and making sure that our communities, agencies, our organizations, the supporters that we have are in a position to make some of these changes and get to those positive outcomes, because we don't want to start implementing strategies that are just going to be short-sighted. So we build this community buy-in, but we don't have the capacity to support it. And we also want to look at effectiveness. So we want to make sure that the effective pieces that we're implementing, or the interventions that we're implementing, are effective and they're in alignment with appropriate prevention methods. And the Underage Drinking Enforcement Training Center, UDETC, is a wonderful opportunity to get some course books and toolkits related to appropriate strategies for related to alcohol use, so alcohol compliance checks, vendor education programs, even social host ordinances. Those are opportunities there to kind of connect with that. And again, that's the Underage Drinking Enforcement Training Center. And then when we're looking at really building that community support, we want to make sure that we're doing so in a thoughtful way and it doesn't just happen. So we want to have encouragement, really encouraging that community ownership and that buy-in, that we develop community leaders and champions, because we can't have one person do it all. A lot of the challenges that I see in working with community coalitions is that the coalition is strong, they're developing, and then the curse of the coalition is getting a DFC, because now there's money behind it, and suddenly the responsibility to do all of the work is the paid coalition person and not the rest of the community. So it's really important to develop those community leaders and champions and make sure that they understand what their role is and how the community coalition or the community efforts won't be successful without them. You also want to connect to other prevention efforts locally, regionally, and statewide. Ohio is a great opportunity of having a multi-system network to kind of help with that through our statewide Prevention Coalition Association, which is a network of coalitions throughout the state that can kind of get together, they can connect with one another, and then they can share their efforts that they do to share resources, share ideas, helps with that community capacity and all of those things. And most importantly, we want to celebrate accomplishments publicly and in the media, through newsletters, through email blasts, and you don't have to wait for a huge thing to celebrate to come through. You can celebrate along the way. And it's important to have those celebrations because this work is long and it's tiring, and a lot of times people get burnt out. So a way to kind of continue with that engagement is to really celebrate those victories, whether they're large victories or small victories, in order to really have some of those long-lasting benefits that will help with that. And then the final thing that we'll talk about today before we kind of move into our question and answer and get a sense of your polls is looking at effectiveness. So a key piece to sustainability is effectiveness. So are the interventions aligned appropriately? So we want to make sure that they're aligned with the problem and risk factors and that they have sufficient reach to connect with the audience members or the community members that are the target audience. Are the interventions a good fit, and are they evidence-based? And NREP, the National Registry for Effective Prevention Programs and Practices, is a great source to get a sense of evidence-based programs, but it's really up to your community to determine whether or not they're a good fit. So you really have to know your community. Also, you have to be in a position to make sure that implementation is done at a high quality level. If you have a kind of scattershot approach, then that's going to have a very limited impact. And so when you're looking at instituting these strategies, you want to make sure they are done at that higher level. And then finally, looking at that evaluation plan and make sure that it provides that ongoing data to see if you're making changes and strides within your community. So looking for the data to really support that. And with that, we'll go to our final quiz, or our poll question. And that is just to get a sense for you of where our focus should be for the upcoming webinars. Where I'm looking to devise these webinars, I want to make sure that they're appropriate for you and your audience. And in doing so, my question for you is, for the upcoming webinar sessions, where should the primary substance abuse or substance of focus be? So should we look at alcohol? Should we look at marijuana? Should we look at opiate abuse? And should we look at tobacco? Because when we're looking at really putting together an effective webinar series for you, I want to make sure it's consistent with what you and your community needs. And some of these will be very dependent on what your community looks like and what the attitudes are. So take that opportunity, just a few more moments, and type in if you would like to see the next two segments of this webinar series focused on alcohol, marijuana, opiates, or tobacco. And while you're tapping that in, I will jump ahead here and look at questions. 4-0, and it looks like Karen is on it. I'm sorry, I just read Karen's question. Emily is on it. For opiates, does this include prescription drugs? Was Kathleen's question. Yeah, opiates would be inclusive of heroin and prescription drugs as well for your quiz questioning. As you're responding to that, I will just start with some questions. This question is from Karen, and Karen's question is, I have seen research that medical marijuana also had higher use rates prior to beginning to have medical marijuana available. Can you confirm this? And I am not sure, so my short answer is no, I can't confirm this. Youth rates for marijuana from states where marijuana is legal is higher than the national average. Adult rates are higher than the national average as well. I'm not sure if that has happened prior to the laws being instituted or not, so we could do some additional research for that. To take a moment here to go back to the polls, it looks like we've got the majority of folks in, and I will hopefully display this. Oops, sorry, I hit the wrong button. And share. So it looks like the primary focus for the upcoming webinars should be related to marijuana and alcohol. So when we're looking to put those together, we will definitely make sure that those two pieces are included, followed by a pretty strong second or third and fourth with opiates and tobaccos. So as we look at this, that will kind of be the area to focus on for our upcoming webinar series. And now we've come to the question section, so that should be popping up to your screen shortly. Question from Vivian is, parents who host is national. Are there laws penalizing parents who provide alcohol to minors in all states, Massachusetts, for example? And Vivian, I can't speak specific to Massachusetts, but I recommend that you check out APIS. And if you can just Google APIS alcohol, it's AIPS. Then that will provide specific laws and resources to your community. And it is illegal to provide alcohol to anyone under the age of 21 outside of your own child in all 50 states. Now, there are some states, such as Ohio, where it's legal to provide alcohol to your own child. Again, check out that APIS site, and I will use or have APIS as a link in our follow-up email, along with the Underage Drinking Enforcement Training Center, so you'll have those resources to go from. And the questions keep coming in. Again, if you have questions, please feel free to ask it in the questions field of your GoToWebinar navigation panel. And we have somewhat limited time to address questions But if we do not get to your question, please feel free to contact me, and I'll be happy to connect with you as well. And my contact information will be on the screen shortly. The next question is from Karen. Where are we able to find information about environmental strategies, and what data on research makes them evidence-based? Again, I'd recommend that you check out the NREP, the National Registry for Effective Prevention Programs and Practices, as well as the Underage Drinking Enforcement Training Center. Those both have resources related specific to environmental prevention strategies. Again, when we're looking at those fidelity pieces, it's really challenging to see. And we'll talk in greater detail in the upcoming webinar about some more specific resources pertaining to individual strategies in the 4 areas of the CAMP acronym. So the next webinar will focus on community norms and media messages, and our third and final webinar will focus on access and availability and policy and enforcement. So we'll have some additional information related to that. This question from Cody is, due to changes in legislation in Kansas, we are now unable to administer surveys without parent consent. Parents must opt their students in, not opt out. It's now becoming a struggle to get consent and always getting schools to work with us. What are your thoughts or suggestions? Cody, that is a great question, and I've not heard of communities that have had that problem. From my perspective, I would definitely try to connect with the parents as much as possible so that they're able to see the value behind the data that you're trying to get. And I'm sure that none of their students would be participating in any activities that would be something that they might not approve of. But it's really important in case that is the case for their students that you're really able to get a clear sense of what your community looks like. And without that data, it's really hard to do that. So I would really make the case for getting them to opt in. And the passive permission is definitely a great thing that we were able to work from. And I definitely recommend that you add those as well. Also think of other community surveys that might not be school-based. So could you work with other social service organizations such as Boys and Girls, the YMCA, other organizations to kind of get to surveys within your target population that might not necessarily be school-based. Karen, where is the documentation that compliance checks are evidence-based? Karen, again, you can look at the Underage Drinking Enforcement Training Center, and when we're looking at access and availability pieces, I will provide some resources for that in our upcoming webinars. And Emily's got some more questions for me. Thank you. Vivian. Vivian's recommendation is to do a vaping webinar, and that is a great question and a great reminder for me. As we look at our program webinar series, we are continually looking for things that will be important and influential for your community. So if you are interested in a topic, please be sure to let us know, and let us know by going to the survey questions that we do. After each session, we will send out a SurveyMonkey survey to get a sense of not only the overall value of the session that you attended, but also to get a sense of some upcoming needs that you might have. So, Vivian, that's a great question for your vaping, and we'll definitely put that in our list for upcoming webinars. And thank you for the Barbara. Thank you, Barbara. NREP is not the only registry, and NREP is kind of going through a variety of processes. It's also important to check with your state authorities to see what evidence-based programs and practices that they see as beneficial and that they fund. Ohio, for instance, has its own organization that kind of monitors them. I know that Wisconsin and New York do as well as many other states. So if you're looking from a funding perspective, it might be even more important to look to your state authority to see what they see as something that they would want to fund and what they view as evidence-based. And question from Ray, will you be sending out participation certificates for this session? And Ray, yes, in addition to the link to the recorded session, the copy of the PowerPoint slides, We will also be sending out a certificate of attendance for the session, and you should be expecting to receive that by Friday of this week. It takes a little bit of time for the folks to get things processed on the back end here, but that will be on our YouTube site. And if you have folks that were unable to attend a session today, either one of these sessions or for one of the three-part series or one of the previous sessions that we've missed, we do have our webinars archived on our YouTube channel, and our YouTube channel is Drug Free Action, and these are just the titles of the most recent survey or webinars that have been conducted, and those are all there for your viewing at your leisure. So if you have folks that missed today, it will go up to our YouTube channel, and everybody that registered, you'll get all that information as well. But just wanted to make sure that you were knowledgeable about those resources and opportunities through Drug Free Action Alliance. And this is from Kathleen related to the INREP registry, and her comment is there's also a rumor of CSAP creating a fidelity/best practices document for environmental strategies. So Kathleen, when that comes along, or if you have additional resources for that, or anybody else that's on the call, please let us know about that as soon as possible, because that would be an important piece to share with folks, because environmental prevention strategies are really an important piece to support the individual or the efforts from the individual perspective, and we want to make sure that we're able to provide communities with as much information as possible. And can you give some examples of where or how to collect quantitative data around illegal substances other than a treatment and arrest data? And that question is from Dawn. And Dawn, that is a great question. You could do a community-based survey to get a sense of what is happening within your community that's going to be beyond arrest data. And also looking at some key leader informant surveys, particularly if we're looking for medical personnel that might come in contact with folks that might be exhibiting some use of illegal substances that may not be reporting them to law enforcement side of things. So there are a variety of areas in which you can get some of this data. You could do, again, just a general community-wide survey to get a sense, check with some of those community leaders and others that might be coming in contact with them. So look to other social service outlets that might be helping with that. So soup kitchens, homeless shelters, looking at domestic violence, because we know that there's a strong correlation between substance abuse and domestic violence, so looking at avenues there as well. So those are some things that are outside of just our normal legal area, because we know that a lot of folks don't get caught into the legal system until they might be well along, so that's not the only data sort. Do you have the dates for the next 2 sessions is Peggy's question. And Peggy, those dates are on your screen right now, as well as the link to register for them. So you can go to drugfreeactionalliance.org/upcoming-events to register for the next 2 trainings. And I will also put those links out in the emails or the follow-up email that I have. From Denise, it's the primary responsibility on the parents in regards to prescription drugs for teens in our community. So teens use might be a challenge, and when we're thinking about our different partners and our areas to engage, it's great to have those folks to kind of lean into, particularly if it's an engagement point for parents, to really get them to understand their role in addressing some of those areas or avenues to connect with students. And this question from Kathleen is, I wondered if the states where marijuana has been legalized and use is up, is opiate use, abuse, and overdose decreasing? I don't believe that it is, but I am not confident for that. I will send that question. Tony Coder is our marijuana and other type issue guru here, so I will certainly ask that question of him and get some additional information there. Are there any tribes who have developed a marijuana policy? This is from Valerie. And Valerie, that is a wonderful question. I don't know. I do know that it was either this year or late last year that the federal government opened up the responsibility or the availability of setting their own laws related to marijuana to the tribal communities. So I'm not familiar thus far if any tribes have developed a policy related to marijuana thus far. But again, I can connect with Tony to see if he might know about that. Emily, do you see any additional questions? Okay. I see some other questions coming in, but we are out of time for today. Again, if you do have additional questions, feel free to ask or email me at dlongmire@drugfreeactionalliance.org, and my information should be appearing on your screen shortly. Thank you so much for your time for today, and this is the first of our three-part series. So please, within your evaluations, let us know what other areas we can focus on to continue this prevention webinar series and make sure that it's as engaging and beneficial for you all as possible. Thank you again for your time and attendance, and we look forward to talking to you next month.